JR, have you ever seen One Flew Over the Cuckoo's Nest?
No, I haven't. Should I have seen it? Is it like required viewing?
It should be required viewing for this show. It's about a guy who ends up in a mental hospital where they use electroshock therapy and lobotomies as punishment.
Oh.
Yeah. And there was also a horrible nurse named Ratchet.
Nurse Ratchet?
Nurse Ratchet.
I got that dish. Dish. I got that dish. I got that dish. That dish.
Hey y'all, it's Onika.
And JR.
And you are dishing with Dainty Dish. How you doing today, JR?
I am fantastic. It is a lovely, what is this? It's March. We're in March now, so it's a lovely March day. It's kind of cold, but I'm doing okay because I'm inside. How are you?
I'm actually kind of sad today. I know people might not think this important, but I grew up watching Beverly Hills 90210, and I heard that Luke Perry passed away of a stroke at 52. And it made me very sad. Cousin Candace told me.
Wait. Time out.
Candace she texted me because she knows I'm obsessed with Luke Perry. Like I have been since I was like 7 years old.
Oh, wow.
And he just yesterday it was he passed away of a stroke. So it was of a natural cause. Thank God, nothing drug related or anything crazy. But at 52.
Oh, okay.
So Dylan McKay, I will always love you.
Wow.
So I'm a little bit sad, but hopefully he's in a better place.
Okay.
But we have a guest on the show today, a returning guest. Actually,
Ooh.
We decided we left her so much the first time we had to have her back. So Faith, say hello.
Hello.
Hey.
How are you doing today?
I'm great. Thank you for having me back.
I'm very excited to have you on the show today.
I had a lot of fun the first time.
You did?
I did. I had a great time. It was my first podcast, and I wasn't sure how I would feel about it, but I absolutely loved it.
That's good.
So it was a really positive experience. So thank you for having me back.
And it was well received. It was a very
Awesome.
well received podcast. So
Awesome.
But there was something very specific that you got into in the podcast. You kind of breezed over it, actually.
Did I?
Yeah.
I wish there was like a video evidence of that because like my face was in shock and I couldn't even like get a word out. I was just like, I want to ask a question. I want to ask a question, and it didn't happen.
Well, that's not unusual when I'm when I'm around.
Oh my gosh! So Jr., do you want to?
No,
I'll ask the question then.
Yeah.
In your story that you were telling us, along your journey, you've experienced what's formerly known as electroshock therapy, now electroconvulsive therapy, and we wanted to talk about that today. What that experience was like, and your opinions on the whole form of treatment, really.
Okay, yummy.
Yeah,
I can't wait. All right. Should I just go?
just go right ahead.
All right.
Yeah, go ahead.
How did it
Okay.
happen? What happened?
Okay, so a bit of background. I have treatment-resistant depression and anxiety. And for the first 5 years after I was diagnosed, I was tried on one antidepressant after another. And they either made me horribly sick, like continuous vomiting, I thought I was going to have a heart attack, that kind of thing, or they did nothing at all. So after 5 years, I was tried on 20 different antidepressants and had to come off all of them, some of them suddenly, some of them slowly. Excuse me. And so finally, after that 5 years, my older psychiatrist said, I have nothing, no more drugs left for you to try. The only thing left is ECT. And I had always resisted it because I didn't like the idea. I'd started my career as a nurse and I had seen people who had it. I had seen it being done. So I wasn't very keen on it. And most of all, I was worried about short-term memory loss, which is a pretty strong side effect, pretty common side effect. So, but at the end of the day, I tried everything with drugs, and this was the only thing left. So eventually I had to submit to it. And so I was booked for 12 treatments. It was done in a large downtown hospital. Hospitals do them as well as places like CAMH. And so the way it happens is that essentially what it is that ECT is giving your brain a seizure. That's what the electricity is doing. So what happens is I would go in and I would wait in this horrible room with a bunch of other people. And then finally they would call you in and there was a bunch of us they were all doing it sort of as a batch. And so you go in and they put you out under general anesthetic, and they also give you a muscle relaxer. They put electrodes on your brain in certain patterns, trying to target where they believe the depression is the worst or is the most controllable. And they essentially shock you and give you a seizure. And so the first time I went in, I found it very difficult because when you were waiting, no staff came in to reassure you at all. Mm-hmm. It was all very much sit there and you wait, and you wild animals, you wait till we're ready for you, because people were naturally getting very anxious. And so my first day that I went in and they did a gentleman beside that was just near me first. And they didn't even pull the curtains around his bed when they did him, and I was still awake. And you could see him jump up, like his body leap up in the air when they applied the electricity. So that's not a good start, because you're supposed to pull those curtains for his privacy, and also because probably not good for people to see that kind of dramatic reaction to the shock. So that didn't put me in a good place. But anyway, with me, what happened was I was scheduled for 12 treatments. At 10 treatments, they declared it a failure and it was stopped. So I still had my depression, but I lost my short-term memory. So the thing that I had feared the most actually happened, but also I didn't get the benefit. It would be different if I said, I lost my short-term memory, but my depression was a lot better. And that wasn't the case. So, and that I think is common. My understanding is that ECT is used almost exclusively for depression and schizophrenia. There may be some other types of mental illness that it's used for, but those are the big two. And my understanding is that with depression, at least, they say it's 78% effective. And that is great, but that is also a short-term benefit. You still have to go back and have more.
Oh, so this isn't permanent.
No. It's not a one time deal.
Even after if you had done the full 12 sessions, the results weren't going to be permanent.
Not necessarily. I think with some people it is. Okay. Because it's kind of like, when you think about it, it's kind of like rebooting your computer.
That's what I was thinking about making that comparison.
Exactly, because the brain is stuck. And so with some people, it's sort of wow, because I have talked to, people that said, until I had ECT, I was getting nowhere and all this kind of stuff. So I never like to put it down. I simply tell you my experiences, because it's not up to me to tell people whether they should or should not do it. However, it is something that I think you have to really carefully think about. Treatment is used a lot with treatment-resistant people like me. And treatment-resistant people like me make up 30% of people that are diagnosed with depression. So 30% of people diagnosed with depression cannot take antidepressants. So within that 30%, another 30% do not get relief from ECT. So whatever, anybody who's good in math out there, 30% of 30%, I'm 30% of 30%. But there are, many people like me where that doesn't work as well. But I'm just thinking it's a big decision and know what you're getting into. The one comment that was really interesting to me was that one of the people that was on this, she was having this treatments at the same time as I was this wonderful, dear, poor woman who came in from London, Ontario, or something like this for this treatment. She was waiting as well for a lung replacement. Okay, so her life was really, really hard because now you have depression, probably as a result of what she was going through. And so you're thinking, okay, she's really been through the mill because of her physical condition. And I remember her saying to the doctor about the ECT, she goes, I don't care for this treatment. And she was a person that never complained. So if you put that into perspective, what she'd already been through in waiting for her lung transplant, and she didn't like, the ECT really bothered her. So that is really what happened with my experience. But I do want to talk about what is slowly replacing ECT, which is a very positive thing.
Okay, so just before we go there, so ECT it's no longer in the form that you received it. It's no longer in that form today.
Yes,
No,
it is.
yes, it is.
Yes, it is.
Yes, it is.
Yes,
Oh, it is. Okay,
It
okay.
is. What I found, because I've never done it, but I often being in the being hospitalized, I've seen people who have gone through the electroconvulsive therapy, and I remember the first time probably would have been probably like 2007, 2008. And I remember them being really they're going into it, they're a little groggy, but when they come out, they were like zombies.
Yeah.
They were like complete zombies.
Yeah.
Fast forward to seeing it in 2016, I found when people were going in, again, they were groggy, but when they were coming out of it, they seemed almost like lifted. It wasn't the big red blotchy marks anymore on their face. It wasn't the drooling or the dragging of speech or any of that. So has it evolved? Would you say?
Let's put it into perspective that ECT was invented in the 1930s, I believe 1937, and it was invented in Italy. And I'm not sure exactly how it was discovered, but somebody actually fooled around with it and found out, hey, this could do something. So 1937, that was a long time ago. Okay, and it has basically, I think what you're saying is they figured out with the anesthetic and with the degree of the dosages that they don't just go one size fits all, zap, here we go. So I am sure, and people have told me, that progress has been made. But when you think about it, 1937, okay.
Fact check, 1938.
38.
Thank you. I
And
knew.
another little quick thing, because I just read it right before we came here. Last year, April was the 80th anniversary of electroshock therapy. So
see.
last April 2018
So
was the
80
It's been going around for 80. It's been going on for 80 years now.
Right. So where I was going with that was that it's taken from the 1938 to say a few years ago for them to improve how this very difficult procedure is done. And to me, that comes back again, my old bugaboo, stigma. Because if this was to do with, say, a diabetic procedure or a heart procedure, and people went, wow, this is really rough to take, and it's really hard, people would have been, I dare say, working a lot harder on saying, how do we make this less uncomfortable? How do we make this more comfortable? How do we get rid of these sorts of things? And because this is what I believe, it's mental illness, kind of, okay, it'll be fine, because I fail to see that that's acceptable, that within 80 years it's changed actually very little.
Yeah.
Do you know what I mean? Like other things would have been really ramped
would
up.
have more progress.
Now,
Yeah.
is that because there's... Don't shoot the messenger.
No.
Is this because
I won't
there's
do that.
such a small percentage of people in the population that suffer from depression? Because, if you look at our Canadian population, we're like 38 million, 35 million,
Yeah.
something like that. So let's say if there's what, 300,000 people suffering from depression. Isn't that like 1%?
Okay.
Is that a problem?
It's a very, I hate it when people say this, but it's complicated because we're only talking about the people that we know that have depression. There's a whole pant loads of them out there that have not yet been diagnosed, but are living with it. Why? Because they don't want the stigma of being diagnosed with a mental illness, or they have no resources to support them. One or both. Okay?
Yeah.
So you've got this whole... I just lost my train of thought. Whoops. What was...
You were saying
Oh,
about
yeah.
the stigma.
Okay, I got it. So that 1% is not representative of people that have depression.
Okay.
The stigma has led to many more people very dangerously, in my belief, living out their life without treatment and diagnosis and treatment, because it is a dangerous disease to live with. According to what my doctors told me, so don't everybody jump on me, because they will. But my understanding is that schizophrenia and depression are the two hardest diseases to live with, mental or physical. And or physical.
I wouldn't argue that.
They just are. So even if it's 1%, that's worthwhile investing in progress, because depression is all encompassing and it's incapacitating, and it leads to suicide, and it has a lot of other health issues that go along with it. So I think the number, and also it's going to be the leading cause of disability. I think it now has become or will be within the next year. So I guess I'm kind of, does it really matter if it's
So I
or
understand what you guys are saying, but like earlier we were talking about like the corporate world, right?
Yeah.
And how numbers sometimes matter. So if we say that 10% of our youth are suffering from obesity, that's a problem.
Yeah.
Right? But if we say 1% of our youth are suffering from depression, I mean, that's 1 out of 100 kids. So let's say there's 500 kids in a school. That's 5 kids. I'm not saying that it's not a problem, but I'm just saying it's
But you can tell if a kid has obesity. You can't tell if a kid has depression.
Fair enough. Fair
So
enough.
you
Yeah,
can't.
yeah, yeah.
You don't know. Again, everything we talk about with mental illness, mental health, to me is understated, because as so much of it is covered up. When somebody dies of an overdose, that could be an intentional overdose.
Correct.
And it
correct.
very, very often is. It is ruled as accidental very, very often, because of the rules governing what determines what is an intentional overdose. So we must appreciate that an awful lot of people pack it in and it is not declared as a suicide.
And they may be suffering.
Okay.
They may die or suffer from something that is a byproduct of
Exactly.
of
It's very, that's why I started off saying it's very complicated, because if we were looking at cancer, for example, we could look at stats and say, because people in rare case, you can't hide cancer for that long, right? It's going to come out, then you're going to be in the system, then we're going to know how many cases we have. That is not the case with mental illness, because of, here we go again, stigma, which has held us back. So anything that we guesstimate or think about is really the tip of the iceberg. It's like an iceberg where you could got 25% above and 75% below. And I think that's
a good analogy.
Thank you very much. I just used it in a class, so it's fresh in my mind. But that's why I hesitate to ever go with stats and say, because stats are based with mental illness on how honest people want to be and how, whether they are or not, they will come forward.
Well,
so I guess we have to work on getting people to, I guess, talk about mental illness and just be
completely
fully accepting of it. Like, it's like, you know what, if you have the flu, no one's really going to judge you.
Yep.
So, or if you've got cancer, no one's judging you. So, I mean,
that's what I work towards.
I guess that's what we got to work towards.
Is having, I could go into work and say, if I worked in the corporate world still, I don't, but ideally if I was able to go in and say, gee, I've been diagnosed with depression, and somebody else went, oh wow, that's too bad, my brother has that and here's what he's doing. And so we would normalize it. And then it would become like we discuss our other problems, and that's how we support each other. And that's one of the problems with mental illness, that you don't get that support because you're ashamed, and the whole hairy thing, goes on and on. Sorry.
Honestly, there's a whole, and this is why I asked you the question at the beginning of the show about One Flew Over the Cuckoo's Nest, because when I was in high school, that's all I knew about mental illness.
Yeah.
Was that like sensationalized movie where electroshock, like when I thought of electroshock therapy, I thought of that movie and what they did in that movie.
Right.
Like, what do you think, like in regards to stigma, do you think that with electroshock therapy, with movies coming out with electroshock therapy, is that something that's causing more stigma, or is it?
Yeah, because it's Hollywood, right? It's the way that it's dramatized. It's the way it's
not helping.
It's not helping at all. And yet we think that because we're being more open that we're helping, because we're saying it or we're showing it. It's how you show it. I mean, when you show it, just like you said, One Flew Over the Cuckoo's Nest, do you think anybody would want ECT after, or any of the treatments after that? And that's exactly why the movie was made, really. And in a ironic way, was to say, this is what's going on. But then is that going to encourage people to want to get help? Probably not. So anything, I think, that is exaggerated in Hollywood, given the influence that it has, especially on kids, where we're dramatizing, it's the whole problem that we have with language. Like, I'm so OCD, I'm so depressed, totally out of context. And the, Kurt Cobain's suicide note is on a t-shirt that you can buy.
What, really?
Yeah, we are going about it. Yeah, it's really bad. Wow. So we're not being respectful of language, and movies are taking it, they're movies and they want to dramatize everything. And it's not healthy because it's not the reality. What I've described as my experience is not, the reality that they show necessarily.
No.
Mine wasn't great, but it wasn't, the most horrific thing that's ever happened to me. And it's a treatment.
So during your treatment phase, because my only understanding of it is through Mad Men. There was.
Oh yeah, okay.
Yeah, so that was my
John Hamm. Okay, settle down.
But so what was like the recovery period like after the procedure? Like, are you out of commission for a couple hours? Is it a day? Is it a week? Like, because in the TV shows, in the movies, I'm pretty sure like someone goes down for electroshock therapy, they're wonky for half a scene, and then all of a sudden they flash to the next day and they're like, woo, everything's great. So what's the reality like? Like, that's
well, I can only speak from my, because it is individual, yes, right? Because some people. I guess the hardest thing for me was that because my husband had to come with me, because you can't have general anesthetic and then get tossed out and go home on your own. And so it was hard for him because he had to take time off work and take me and then run up to work. And the hardest thing for me, and it wasn't his fault or anyway, I had to go home and be alone. And that was really hard for me because it was a scary experience, and now you're alone and you're kind of reliving it. I didn't have a lot of the grogginess. I did have a bit. As far as physical fallout from it, I didn't really have a lot other than the short-term memory loss. Pretty big.
How do you deal with that? We can answer that after.
I have my little tricks, but I'm mostly honest. Like I told you, I tell other people. So that, but I didn't have that kind of thing. What I had more was because you got to remember that I didn't leave the home for 11 years unless I had to, and this was during that period. So just for me to be out and in a strange place that was hostile, I found, as I've described, they weren't particularly great or at all beforehand or after. It's sort of, here's your treatment, get out. So I found the going home part and being alone was very difficult. And what I would recommend is that you have somebody with you when you go home, because I felt more, the terror of being out and the depression of that I was in this kind of place where I needed this kind of extreme treatment. All that comes crowding in once you're home. So I think the best thing for people is to have support. They may want to sleep all day, but it's great to have somebody there. But I know you had to go to work, so it's just not, and that's the realistic, right? He couldn't stay home one day a week, 2 days a week and look after me. Most people can't. But he was awesome. But that's the only thing I'd really recommend. Everybody's different and reacts to it differently.
Okay. And you were saying you wanted to talk about other forms.
Yes, I do. Thank you very much.
You're welcome.
You're so good at this. There is a new treatment, that's replacing, slowly going to replace, in many, many cases, ECT. And it's called TMS, and that stands for, here we go, let me see if I can remember, transcranial magnetic stimulation.
Okay.
So what it is, and I've also had this, which didn't do anything for my depression, but it really helped with my anxiety, which is great. But what it is instead of using electricity, they use magnets. And so you don't have to be put under anesthetic. You don't have to have a muscle relaxer. You are awake through the entire procedure. And it is a really actually lovely, I didn't mind it at all, where they just sort of buzz you for a period of time that they decide on. Again, trying to hit the areas which are stuck or clogged or however you want to describe it, and move them with a magnetic force instead of electricity.
So it's like an MRI kind of thing.
But they're just, it's like taking, saying electricity isn't the best way to do it. Magnetics can do the same thing. And they don't have all the need for a general anesthetic. I used to sit and talk to this wonderful woman who gave me the treatments. And, we'd have these great conversations. So there's that part of it, which is so much better. There's the cost savings to the healthcare system, because every time you're put out under general anesthetic, that costs us. Plus, you have to be in a hospital. You don't have to be in a hospital for TMS. The other huge benefit, no weight loss, memory loss. Okay, no risk of memory loss. Slightly less effective, coming in around 68%. But here's the cool thing, okay? We talked about 1938 with ECT. When was this started? The magnetic, 1985. So look at how long we were willing to live with one treatment without that had, some people have died by suicide having a ECT. I mean, the brain is a very odd and individual, tricky. You can't tell. If you can give me an antidepressant, it can make me suicidal. You can do ECT on my brain, that could make me suicidal. Very dangerous. So almost 50 years, which is where our stigma comes in, before anybody said, hey, maybe there's a better way to treat depression and schizophrenia than shocking them with electric currents and putting them in convulsions, putting their brain in convulsion. Let's have a thinky and see if we can do anything about it. So all I'm saying is that wouldn't happen with many other types of disabilities. People would be racing. That's not acceptable that you have I keep saying weight loss, memory loss. That's not acceptable. So we're going to fix that.
I mean, a lot of times it's probably like one of the researchers, their child, their sister,
Exactly.
their sibling was affected, and they're like, wait,
Gotta fix this.
gotta fix this.
And
That's usually where like something like that comes from.
Exactly where it comes from. But it's a good illustration to all of us. It's a wonderful thing that, thank goodness that TMS is now they're now trying it first before going on to ECT.
Okay.
Because that's a relatively high success rate when you're foodling around with the brain. So that's good. Doesn't have all the bad things with it. So they're trying that. So I would love, I want to see more and more and more where that is tried before. And because there's so many people that can't take drugs there, and do they really need to go all the way over to brain seizures before we try something in the middle? So I'm really want people to understand that there is an alternative. If ECT is suggested, they should recommend that they want to pursue with TMS. You have to push, because doctors will do what they're comfortable with. And all those doctors out there, I don't want to hear anything nasty from you, but they will, they're just everybody else. We do what we're comfortable with.
I mean, when you're trained in a profession, and you said since 1938, they've been doing this procedure. It is the tried, true, tested procedure.
The gold standard, I was told.
So, like 1985, there's that's I was born around then. So, I mean, that's
my
only
goodness.
that's less than that's 35 years, right? Like, so, I mean.
But do you understand what I'm saying?
100%,
that to me, it's unacceptable. And that's the good thing that we say that, because we don't want that to be acceptable. And we want things to change and to get faster, because people are suffering, people like me. And so, we've got to get more creative. We've got to be, and again, you've got to push your doctors. Many doctors will say, don't know anything about it, never heard about it. Do your research and move towards that as a first choice.
The CAMH site, because I've been fact checking as we've been talking.
Oh, cool!
And now everything's listed on there, like all the information. Like
I was on there earlier. I had a question for you about that, actually.
Oh, go ahead.
Go ahead.
Yeah, so I was reading because they were talking about the history of ECT. That's where I read that fun fact from earlier. And they also made a statement that ECT, of all the therapies, is the most vilified and validated.
Right.
Of all the therapies for depression and schizophrenia. So how do you feel hearing something like that? What do you think about that?
Well, I totally understand it, actually, because I've talked to many people who were in the same situation as I was with the oral antidepressants and sick, and you really can't live a life at all like that. And so I have talked to a number of people who had ECT, and it changed everything. They felt fantastic. That's why I never want people to be discouraged, to not do it because of what they hear about it. Because other people it has changed their life in a completely positive way. So that is what was the other V? Validated. Thank you.
Vilified.
And vilified because of the reasons that I've said, that if it doesn't work, it don't work, and it can do you great damage. So if I'm not going to be singing its praises. I think I'm very fair about it, given what it's done to me, and given that it didn't work. Had it worked, I'd probably be one of those ones singing its praises, because I wouldn't be living with, the degree, which is significant, of depression that I'm living with. So, but I try and keep an open mind, and that's why I wanted to bring in that TMS. There are alternatives, that ECT has worked for people, and I would never take that away from ECT. But as far as I'm concerned, the way that ECT and drugs deal with the brain is very much on a hit and miss basis.
Yeah.
Okay? Because the great results, excuse me, they don't know why. Okay, and that's one of the most frustrating things about having mental illness and talking to any psychiatrist. The most common answer that you get is, we don't know, we don't know, we don't know. Well, I'm sorry, but it is, I know the brain is the most complex of any of our organs, but it's one of our organs. And we've had a dang long time to get to terms with studying it. We can put people on the moon. We can do all this other. No, but I mean, think about it. The thing that we use every day, all the time.
I think the biggest challenge is that, like, in order to do, like, you can't really do research on a living brain. Like real nitty gritty, like
but hardcore.
It's really tough.
But it is. But think about it this way. In the 1970s, I believe, don't quote me again, they came up with a form of questions for psychiatrists to figure out if you're depressed. Okay?
Okay.
They're still using it. There should be, they should be able to do a blood test.
Whoa.
Because look at how sophisticated we are with other forms of medicine. We have medicine, we don't even have to cut into people. We can do it with instruments. We know enough about what causes depression and what goes wrong. And maybe, okay, not a blood test, but an MRI. And they can look and say, okay, yes, she has this kind of depression. This is how extensive it is. This is what we're going to do. Instead, it's a question, like, do you want to kill yourself? So you're doing the same things as 40 years ago? That's as sophisticated as we get. Am I sounding angry to you?
No. You don't sound angry.
You sound passionate.
No. You sound passionate.
I am passionate.
I'm just sitting back and thinking, okay, I don't think it's that simple, because we've also had people that are also misdiagnosed with depression. And I mean, also, I might be wrong, but I'm like, isn't depression subjective?
No.
No.
There's situational depression.
That's subjective.
If my mom dies, okay, I'm going to be very depressed, and that's part of grieving, and that's situational. If I lose my job, I'm going to be very depressed. But the rest, that's why I'm talking about language, where we go, I'm so depressed because, Netflix wasn't working tonight. Okay, depression is a terrible, and he's laughing. Depression is a terrible. I know, it's the horror, right? Depression is a terrible, terrible disease. It is genetic, and so it is genetic. It is part genetic and part trauma, environmental. Thank you. And so, as I think I explained last time, what happens, and I'm very typical of most people, is I was born with it. I grew up. I managed. I did some weird shit, but I managed. I had careers, nursing, etc. But all of a sudden, within 2 years, my mom, my dad, and my best friend died, and that forced the depressive gene to take over, because the gene plus trauma equals full blown. So the idea that people go, obviously you're depressed based on a situational thing, but the disease itself, which is a very different thing, is, like I say, considered to be the hardest to live with. Sir Winston Churchill, who, look at all he did, won the war, etc., suffered terribly from depression. And, in the days when there was nobody to help him or nothing to do. And he was a brave man who didn't complain a lot about a lot of things. And in his journals and diaries, you will see his terrible pain at dealing with the war, like that's not bad enough, at living with depression. And many famous people.
Can we go as far as saying then that the depression is natural?
No.
It's a part of humanity.
Well, it's a disease of humanity. It's a disease that can affect anyone in humanity. It affects all cultures. It affects all nationalities, whether they acknowledge it or not. I have a friend who lives in the Philippines, and he said it's not even a thing here. Depression, nobody understands it. And I can guarantee you there are people that are very depressed in the Philippines. but if it's not recognized that as a disease, then, and it's also one of those things where people tend to say, pull your bootstraps up, start feeling sorry for yourself.
Yeah.
Get off your bum and go for a walk.
I say that to Anika all the time.
Yeah.
Well,
When I
get that too.
Of depression.
But you know what I mean? The quick, that it's you're feeling sorry for yourself or somehow indulging yourself. I when I talk about it, I say it's often perceived as a weakness or a lack of character. It is not. There's obvious symptoms of it and signs, and it is a disease. So we've got to. That's why I don't like people saying I'm depressed, because I cut my cuticle type of thing.
Yeah, it's similar. It's similar with bipolar. There's like a chemical imbalance in my brain that that's what they've said. That's what they've told me. They've done the MRI. They've done the scans. They did all that. It's a disease just like any other, and it should be treated just like any other. Unfortunately, it's not. However,
no. And when you think about it, somebody corrected me because I go physical and mental, and they go, well, it's all one thing, right? Your brain is physical. It just has this amazing other powers, but it's physical. Look at what it's doing, controlling so much of what we're doing, plus our emotions, plus our inspirations, plus all the stuff that we have going on. But it is part of our body. And this is why I said that you should be able to go in and get a blood test, and it would tell you. Maybe it can't tell you how depressed I am, but there are chemicals released when a person is actively depressed or has depression. I should by now, not some guy going, how's your appetite?
21 questions.
Yeah, but I can, and the other thing is it leads to abuse of it, because if I know the answers.
That's where I want to go next as well.
Yeah, so that's where a blood test solves your problem, because how many people, they are doing it, right? They can go and say yes, because they know the answer. So it's a totally unreliable and unprofessional, oldie-fashioned way to diagnose, any disease.
So true. So 10 years from now, 20 years from now, 50 years from now, where do you see ECT going? The electroconvulsive therapy. Where do you see that?
I see that disappearing.
Disappearing?
Yeah. And to be replaced with TMS. Because don't forget, TMS at 30 whatever years it is now is still, again, because of stigma, hasn't been on the front burner. Mm-hmm. But I see it with the crisis that we're in right now with depression and our lack of ability to treat people, and the fact that you can treat them so much faster and easier with this. I see it taking over from ECT and reaching the same level of success, if not higher, than ECT has. Because it's still fairly new, it's probably that 68% that it's at probably has a way to go up. Because I'm sure that ECT, when they first started doing it, was not at 78 or 80% or, the claims that they have for it now. It got up there as they foostered around and practiced with it. So in 10 years, I see ECT being a rare, if ever used, thing because of its side effects, and it being replaced with magnetic, which would be a great thing.
How many, like you said, for ECT you had to do 12 sessions. How many for TMS? Is it less sessions, more sessions? Are you aware of that?
It's usually more, because you're getting a lower impact at the time, which is helping you because you're not as disoriented the way. My understanding is, again, I can only speak from my own experiences, but I was part of a pilot project at CAMH. I was accepted on compassion terms because they felt so badly for my condition. Normally, I would have had to go through a lot of testing, but the doctor, God bless him, took one look at me and said, "You're in on compassion basis." And I had it for 2 years. As they tried different dosages, different locations. Again, it did help my anxiety, unfortunately not my depression. But it was a wonderful, I was going twice a week. And you start off, you do it, you say 4 times a week, and then you go twice a week. And so then you go once a week because they want to get a lot in there at the beginning, start to shake things up. And then I was going once a week, and then they pulled the plug on me going back because they weren't getting the results for the depression.
Okay.
But they were really good to let me do it for that long when they weren't getting the results. But I just see that as the future now.
Do you think it's going to be something that can help anxiety just in general? Like if it helped yours, do you think it could be something like another? Because we have depression, we have anxiety, we have so many. There's so many mental health illnesses. But,
so many. And if you have depression, you usually have anxiety.
Yeah.
So the two go hand in hand. Evil siblings, I call them. They're actually Toronto Western Hospital is starting. They have a unit there dedicated to treatment-resistant depression and anxiety, and they are now using it for anxiety. The only reason I'm not part of that test is because it's a big commitment of my time right now, starting new job and all that kind of thing. But I'm considering going back to see to get into the anxiety program with TMS. So it has a whole beautiful future ahead of it. And also for the people that get the treatments, because they're not going to be traumatized, they're not going to be as inconvenienced, they're not going to have have somebody have to come with them to this treatment, all these benefits. And if they can get help from it, that's the main thing.
Okay.
Was that not sassy enough for you?
It was super sassy. It was super sassy.
I was going for a line, but really, I just want, I wouldn't want someone to experience what I had to. But it is part of the nature of the beast. You have to try everything unless you want to sit in your current misery. And I guess I'm cheesed off because it should be further along, as I've said, and I have every right to be cheesed off that is not further along when, we have all these, they almost have now a cure for MS.
Really? Okay.
Yeah.
Wow.
They're very, very, very close. So huge amounts of progress made in many, many things. And that's what we really need to see, because I always say that it's our happiness that's at stake here. What is the most important thing in life is our happiness. Mental illness that cannot be treated, you cannot be happy. You cannot fulfill what is everybody's right. And I think about children, that are waiting 2 years for a psychiatrist that have made a suicide attempt. I think about, though, not just myself, but the people that are also suffering and children that are coming up. So we have to change, and I really appreciate this opportunity because this is what helps change. This is what makes change.
Yeah.
I mean,
when we talk about it.
That and them being able to map the brain more.
Absolutely. Absolutely. Get on it
mapping.
now.
All the scientists and the doctors mapping the brain. I mean, we just got to hope that they can continue to do that. And because the more they can map,
beast out.
The more they can map the brain, they can fine tune the areas that are, I guess, are specific to depression.
Hotspots.
So then instead of having to spend so much time, I guess, having to figure things out, they can just go, okay, we know these areas are
because it's risky. It's not like if I have a bladder infection and my doctor doesn't give me quite the right antibiotic, he can switch it over. It's very different if I don't get and who knows, because the answer is always we don't know. So if we don't know how the brain works, we're shooting in the dark, aren't we? If I take a pill that now makes me more depressed and suicidal, that is a whole different ballgame from my bladder infection or other types of infections, which I'm not saying aren't serious, but you can quickly see what's going on with them in terms of their efficiency. This is a whole different thing. One thing that's interesting is that when I was, this shows you where we're at, was that when I would be on antidepressants, and of course they wouldn't be suitable, You can't just go, no, I'm not taking them anymore. I had to be weaned off
Yes,
them
you remember you
because
saying
you
that.
will die. You will die if you just stop. And so how many situations, other illnesses have this kind of restriction to get faster help?
Do you find with ECT, is it a first resort or a last resort? Because it seemed like it was the last resort for
Last.
you.
It is a last.
It's a last resort.
Yeah.
It's not a first resort.
No.
Okay.
No.
Okay. Because on the big bad scary list for me, that would be number one scary if they didn't find because I have my bipolar, but I do also have the depression aspect to it. That would be like the scariest thing. I couldn't imagine, doing that 10 times. I think you said you did it.
Yeah. And imagine if you're depressed. You know what depression feels like.
I do.
So it's not as if you're sitting there going, yeah, I want to try this. I'm up for that. You're desperate, but at the same time, you're largely dysfunctional. At least I was, because of the extent of my depression. Getting dressed, running a comb through my hair, all the stuff I said before. I mean, I wasn't eating properly, all these other things. So imagine being in that state and then going into a traumatic experience like ECT. It's not as if I'm bounding in going, let's go.
Shock me.
Yeah, shock me, baby. But, I go back to what this wonderful woman said, that shows you that's the relativity, that she had already been through the mill in the physical sense because of her lungs. This bothered her. This ECT bothered her. And that told me a whole lot. Because at first I thought, wow, you sound like Wendy the Whiner. Because I'd sit there going, I want to go home and all this. And they took my clothes away from me in a very, brusque sort of fashion. But I thought, wow, you're really a big baby. And then I heard her say that and I went, no, you're not. You're a very depressed person. And depression shuts down so many positive things about life. You just don't even see them. You can't. And so now I'm depressed. Now I'm in there. They take my clothes away in a merely mean way. And I see a guy leap up in the air because they can't be bothered to do their jobs properly and pull the curtains around him, which is just patient privacy and decency and all that stuff. So that's my intro into the whole thing. So imagine going back 10 times and then going home and, being terrified and all that kind of stuff. So I get it, as I say, that it has helped people. It can be immensely effective. But if we don't understand the brain, should we really be in there with electric giving it seizures when we go, I don't know? Yeah. There's a good question. I just thought of that one. Should we really be doing that?
No, it doesn't. It doesn't sound like a good idea to me.
No, I mean, that's like somebody going in and going, I'll figure out where the gallbladder is and then I'll take it out, right?
Yeah, I
don't know anything about the gallbladder, but I'll go in there and get it and get it out of there.
I'll grab it like Operation.
Yeah, totally.
Like Operation.
Yeah. Like the game.
Yeah. Anyways, Faith, thank you so very much for being on the show today to talk about ECT. Such an interesting topic. And thank you for introducing TMS to us as well. For all those out there that are listening that might be suffering from depression, this could be an option for you. So thank you so much for introducing that to the show as well.
You're welcome.
Do you want to give any shout outs? I know you're going to shout out, but do you want to give any shout outs?
Here's a shout out to my babe, Roy. Thanks again for being my rock. You're the best.
Oh, so sweet. Aww. So sweet. If any of you guys have any questions.
To your show.
Does he listen?
Yeah, he does.
Thank you, Roy. It's Roy, right?
He's an awesome guy.
Roy,
yeah,
right?
It is
Thanks, Roy.
Yeah,
hey, Roy. How
He's
you
an
doing?
awesome guy.
We're going to have to bring him on next time. Talk about relationships and mental health.
He's an accountant. I don't think he might not.
He might not. This might not be his thing.
Love you, babe.
It might not be his thing.
Yeah.
But
he's
again,
a wonderful person.
If you guys want to reach out to Faith, go ahead.
Thank you both very much. And it's an honor to be asked back again. You create the perfect atmosphere to be able to talk honestly, openly, and with a little bit of humor about these difficult topics. So thank you so much for the opportunity. Second time.
Thank you,
Anika.
Yeah, Anika, thank you. Yeah.
Yeah, you're welcome.
Bless you both.
You're welcome, and thank you for being on the show, like I said. So, as I was saying, if you guys want to reach out to Faith and ask her any questions about ECT or TMS, please, JR, tell them, or you want to say hi to me and JR, of course, obviously. Please, JR, tell them how they can reach us.
Definitely. You can reach us at Dysh, DYSH, at daintydish.com. That's DAINTYDYSH.com. Thank you so much for listening. Faith, thank you so much for being here. You filled me in on the ECT thing because I was like, for months now, I've been asking Onika to have you back here because I want.
Really?
Yes, because I want to know like what it's like because I was really curious. I didn't know, and then thank you for like filling me in on TMS, right?
Yeah. So you can dine out now. ECT and TMS.
Yeah. The lingo down.
You can bore people at parties.
But yeah, thank you so much for being here. If you're listening to us on Apple Podcasts,
Give us a 5, use it over 5.
thank you so much. If you're listening to us on YouTube, SoundCloud, thank you so much. Give us some feedback, a like. We truly appreciate your feedback. Thank you so much. Onika does read every single comment and every single email. Thank you so much. Yeah, and if you want us to share your email, just let us know because otherwise Onika doesn't share emails.
Yeah, just put it in the suggestion box for me.
Yeah. But yeah, that's it for me. I'm JR.
JR out. Anyways, that has been the dish of the day. I hope y'all have yourselves a very, very, very happy hump day.